Good day from Joburg TV News. My name is Bonga Ngaba with your top stories. Naptosa and SATU concerned over number of vaccine jabs earmarked for teachers. Randburg text ring complains of commuter non-compliance. ANC staff to strike over salaries. Teachers Union says they are eagerly waiting for the 300,000 COVID-19 vaccines promised by Aspen Pharmacare to arrive, but were worried about the quality being earmarked for the South African teachers. It is understood that these Johnson's & Johnson's doses are not part of the 2 million jabs currently at Joburg facility in the Eastern Cape, which have to be destroyed as a safety precaution. The teachers unions have requested a meeting with the Basic Education Department to discuss guidelines around how the rollout of these vaccines would work. As the third wave grips South Africa, the taxi industry in Gauteng is complaining of commuter non-compliance. Many commuters aren't complying with safety measures as the province accounts for more than 60% of its coronavirus cases in the past 24 hours. Gauteng's health department is already calling for a higher provincial lockdown level as well as a stricter measure nationally. And finally, disgruntled ANC employees embarked on a nationwide strike over the party's failure to pay salaries on time. Gloria Masia reports.
Good day and welcome to Joburg TV. My name is Gloria Masia and today we are live at the ANC Luthuli House in Johannesburg. We'll be seeing the protest of the ANC members. They are protesting over the compensation. They haven't been paid for over a few months. We'll get you more details as we will be interviewing the ANC members and get you more details on this story.
Today, ma'am, we are having a picket. This is a lunchtime picket, which means it's a normal picket that any worker is permitted to have. And the purpose of this picket is to highlight our plight as workers or employees of the ANC in terms of the issues that we find ourselves faced with. These are matters that relate to the salaries of employees, issues that relate to the Provident Fund, issues that relate to the medical aid, and all other issues that relate to the working conditions of the ANC workers. Now, this is what we have decided to come here for this picket. It is not only here in the Luthuli House. This is not a protest. This is not a march. It's a picket. In the main, we want to bring some sense of urgency in terms of how the leadership is responding to the issues that we've been raising. We've been raising these issues for the longest of times, and we have taken this stance now that we will picket because we feel that the leadership doesn't really understand the pain of not getting your salary on the day you're supposed to get it. It's not a political stance. It's not a sign or an indication that there's anything wrong with the ANC. It is a clear message that as members of staff, we are saying, please attend to issues of our well-being, especially as it relates to the month-to-month demands of our lives.
Okay. And what's going to happen if your challenges or whatever it is that you're trying to address here today, what's going to happen if they're not addressed?
We are hopeful that they will be addressed. The ANC also is faced with financial challenges, and we are alive to that reality as employees. And hence we have been giving the leadership space to deal with these issues. Remember, the ANC is not generating any income. The ANC is not a profit-generating company. We are an NGO. We live on donors. The ANC lives on donors. And we're saying we understand that the challenge of finances is there. We're not aloof. We're not in another island. We know the challenges that the ANC is faced with. But we're saying there are urgent matters and they must be treated with the urgency they deserve.
And there you have it, Comrade Mandla saying there's a lot of issues that they are trying to address, and one of them is salaries to be paid on time on a monthly basis. This is Joburg TV, Gloria Masia, Johannesburg.
And that's it from us. Take care and we'll see you next time.